This past July may have been the deadliest month in modern American history for young people, possibly because of the coronavirus. New research finds that more than 16,000 people between the ages of 25 and 44 died that month. Over the past 20 years, an average of 11,000 younger adults have died each July. Researchers say this spike may be due to the coronavirus pandemic. In total, the virus has taken the lives of more than 300,000 Americans. So now an opinion piece in the New York Times is taking a look at COVID-19's impact on this age group. The authors say people believe the disease was relatively harmless for younger adults, but they argue that assumption was, quote, wrong. One of the authors of that article is Dr. Jeremy Faust, and he joins us right now. He's an attending physician at Brigham and Women's Hospital's Department of Emergency Medicine. Thank you so much for joining us. Your piece in the New York Times was really fascinating and also really frustrating because there are so many details we don't know, and I will get to that later. But Dr. Faust, in your New York Times article, you compared COVID-19 deaths of young adults to what happened during the AIDS epidemic. Explain that comparison.
Sure. When you see a major spike in deaths in an age group, you have to wonder what's going on. And we don't see that too often, especially in a younger population. 25 to 44 is the group that we kind of zoned right in on. And so in the 80s and 90s, you just saw this just tragic spike in deaths among people of that age. And then things go back to normal for a long time. And then the opioids epidemic happens and you have another kind of spike. And then COVID happens. And really, COVID is on the same magnitude as both of those crises when you look at the numbers of deaths per month. So back in 1995, just the very worst part of the AIDS epidemic in the United States, you had really on average about 13,000 young Americans dying per month at that time. And we have just gone right past that this year. And it was not just because the population is bigger, it's actually very similar in that age group. So now we've got 16,000, 15,000 in the fall. And so every month is actually worse than the very worst of the AIDS epidemic that we experienced for this younger population, which I think is something that most people haven't really gotten their minds wrapped around yet.
You know, it's such an interesting, your piece was so interesting, Dr. Faust, and it reminded me of a conversation that I had many years ago when I was a younger man with a good friend of mine when I was living in Europe, and I mentioned to him, you know, he was single at the time, and I said, hey, make sure, you know, whatever you're doing, that you're safe and you wear a condom. And he said, have you ever met anybody in your life? You know, they tell us all the time to wear a condom to prevent the transmission of HIV. And he said, you know, you're 30 years old, it was about 20 years ago. He said, have you ever met anybody in your life who has had AIDS? And he said, the answer is probably no. He's like, I've never met anybody in my life. So we know that these numbers are out there, but we don't know anybody. It's not people in our world. It's not people who don't fit the profile of people who have become infected in HIV. And I had to sort of educate him. And I suspect it feels the same way now. You meet a lot of people who say, you know what, I don't know anybody who's gotten COVID. It's older Americans or it's young people who are not healthy. But in my community, we're all safe. These masks don't work. Social distancing doesn't work. You know, end the lockdowns. Help explain why people feel the need to be doubting Thomases unless it affects them directly. I just don't understand that.
Yeah, the conversation you had is the one that I play over in my head over and over again because it is really a law of numbers. So for the kind of thing, like for any of these crises, by the time you know someone who has it, it is too late. Because basically, when you think about the numbers of people who have to get affected, we only know 300, 500, 1,000 people. The average person has 500 Facebook friends or something in that nature. And so you really might not know anyone who's had it yet, depending on where you are in the country. But once COVID has reached your region of the country, then you know more than one person. And then you might, if you lived in New York, you probably know someone who died. So it's one of those things where I say, by the time you know someone, you will have wished you didn't because it'll be everywhere. So that's basically the way it works. But it's also the law of large numbers. So yeah, it's a very small percentage of people who are dying, but we have 86 million people of this age group. So when you do the math, it's thousands and thousands of deaths. And so these aren't just statistics. These are living, breathing people, parents, daughters, sons, cousins, brothers, whatever. And all of a sudden, the numbers aren't just little cells on your Excel file. They're actual people. And so I think that when people, like you said, until it becomes real, then they don't get it. And as a physician, of course, I have the the benefit of seeing that real reality. I say benefit because it hits home. It's not fun to see it, but at least I don't have the situation where I'm in denial of it because I'm literally confronted with it every time I go to work.
You know, doctor, throughout this whole pandemic, we've received kind of evolving information about the virus. And one of the things that I was frustrated about with your piece, and frustrated for you and other doctors, is that I felt like, why don't we have better data on this? I mean, even in our sort of lead up into you, we have to couch our words. We have to say, this increase in deaths may be because of COVID-19. And you should not have to be sort of calling around to different institutions in New York to find out, how many young people have died. Did they come in, were they diagnosed with COVID? Why don't we have better data?
Yeah, that is such a great question. It would make my life as a researcher a little bit easier if it was just out there. But the reality is that it is there. It's just a matter of finding it and having the right access and knowing what it means. But it's absolutely true. When we look at the data that we used for this publication, it's been available almost since July or August. It's been there, right? So when we saw this memo in Politico yesterday where the administration was saying, hey, young people can just go out and get this virus, no problem, that really made my head explode because the data that showed that, yes, COVID-19 was killing thousands of young Americans was absolutely available to those public officials. And so whether or not you and I could have found it at that time, actually probably could have, but they for sure could have done that. And so that's the part where it's one thing to say we didn't know and we learned and now we're doing better. But when you actually could have known, when you actually should have known, that's the part that really is frustrating. Because again, experts, they change their mind when the data changes. But when the data is actually available and you're ignoring it, then you're at a new level. It's a real problem, and we're hoping that this helps correct that.
So young people who are healthy are generally considered low priority in the initial vaccine rollout, but they're also some of the top silent spreaders. How alarming is that as we await getting access to the vaccine?
Yeah, it's a huge deal. Early on in this crisis, first of all, I really felt that the message to young people was, you can spread it silently to someone who can't afford to have it, right? So don't think about yourself. Think about the person who you could infect, who you will never forgive yourself for if you lost them because of that. And so that's really been a message that we've been trying to put out there for a long time. But with this new data that we published, it's that and more. It's that, and also it could be you. I have too many friends and colleagues who know people in this age group who have passed away from COVID-19. So it's a big deal because we're saying, look, this is the age group who's going to have to wait the longest for the vaccine, and also, as you said, has the biggest chance to spread it to other people who are not yet vaccinated, and also themselves really do have a real risk of having serious illness. And we didn't even talk about the fact that there's suffering beyond death, right? You can have this virus and really have terrible symptoms and suffer for a long time. We're learning a little bit about what long COVID or long haulers even means, but we haven't really worked that out yet. So what I say to people is the vaccine is far safer than getting the virus. And we're now in a situation where it's just a little bit of a waiting game. A few months ago, couldn't really say that. We thought maybe a vaccine would be helpful, but now we can say we actually have something for you if you can just wait a little longer. And that's the message. This is not permanent in terms of the changes we're asking. It's really a shorter term thing so that we don't spread it.
Yeah, I'm glad you brought up the whole long haul thing. Both Vlad and I know people who are younger than us who are struggling with fatigue after recovering, just fine from the actual virus, but they still, and weeks later, they're still dealing with issues. What should officials be focusing on now that there could be two vaccines? Your article says that the goal should no longer be flattening the curve to prevent hospitals overflowing.
That's right. If you really thought that there was no vaccine coming, which is what I think was a reasonable assumption when this thing broke out, you would just have had to conclude that a certain number of deaths was sort of inevitable, and that just the idea was if you actually just lengthen over time, then you wouldn't lose people owing to the fact that there were problems in terms of capacity. So if we couldn't save a life because we didn't have enough doctors, nurses, or even ventilators in the ICU, that would be tragedy. But now it's more than just that. It's saying, look, we actually there's no fixed number of deaths that have to occur now. Now there's actually, we call it modifiable. We have a modifiable number of deaths, and that's a huge accomplishment for science. We say it's been a year, but it's really been decades and hundreds of years in the making in terms of our vaccine science. And so what we really want people to know is that we've come this far, and that we can actually really lower that final number. Whatever that final number is, let it be the smallest possible number. That's really what this is all about. And I think that this messaging is designed to help people understand that they're part of that figure.
Really, really interesting. Dr. Jeremy Faust, thank you so much for your op-ed, and thanks for coming on.
Thanks so much.